can't thank you enough, Mr. Chairman, for holding this hearing, and I can't thank Senator Cantwell and Senator Nelson enough for the questions that they've asked. They're part of a series of questions that I had as well. I'm not sure how all this can come together, and part of it is because the states aren't getting answers. My governor wrote on July 19th of 2012 trying to find out enough about the exchange that our legislature could deal with the exchange, and that's how we insist on doing it in Wyoming. The governor doesn't have blanket authority to do whatever he wants. And he does point out in his letter that we're a rural frontier state, and he does know that Rhode Island and Delaware are making progress, but he does point out that Wyoming has half the population of Delaware or half the population of Rhode Island, and we're spread out over a much bigger geographic area. Now, he wrote the letter in July of 2012, and he got the answer. No, he didn't get an answer. He got a letter in January of this year. Now, that's for getting an exchange done? Our legislature meets every year, but this is the year that they do law. Next year, they just do budget and appropriation. So they needed the information before this session started in January. It just lasts January and February. Actually, it only lasts 40 days, and in truth, it'll only last 38 days. They don't use their full allotted time because they like to save 2 days in case the governor vetoes something that's important to them so they can call themselves back into session. So they have virtually no chance to work on the exchange. I guess that leaves the federal exchange. And I'm not sure that they'll have a problem with the federal exchange, except for all of the unanswered questions about a federal exchange. And I can't believe that we're forcing every state in the nation to try and write their own program. That has to have a cost. I mean, it probably costs just as much as doing a federal exchange. And I have no idea how much money we're putting into writing the programs for this federal exchange. I like what you described in the federal exchange, but that's kind of what we're expecting each state to do at that state's cost. But you're providing the money for it. And so my first question, I guess, would be, HHS is kind of give a kind of a blank check, such sums as are necessary to implement the health exchanges. Will there be any cap on the amount of money the federal government will use to do this? And if not, why not?
The amount of money that we award in grants to states to plan and establish their exchange is based on an application that they submit to us and a thorough and rigorous evaluation of what the needs are in order to do that. I think as time goes by, and if states choose to operate their own exchange in future years, they will benefit from a lot of the work that's already been done, because as I mentioned, one of the requirements of these grants is that the work that vendors are doing for states now be made available to other states going forward.
Now, it does look to me as though you're trying to force everyone into a federal exchange, and that may be our only option. And I noticed that it's to be paid for with user fees. Who pays that user fee? The individual, the state, the insurance company? And what does that, how much is that going to be?
What we've proposed is a user fee that would be 3.5% of premium earned by insurance companies selling products in the exchange.
So it would be the insurance company paying it?
Based on the premium that they earn on selling their products in the exchange, yes.
Now, on this federal exchange, one of the things I have suggested in the past that there be some right to buy insurance across state lines. Will that be the case with the federal exchange?
The federal exchange will, the products that will be sold on the federal exchange will be sold within each state and will be approved by the state insurance departments of each state. There is a provision in the law for a multi-state plan that the Office of Personnel Administration will be operating, and they've issued some proposed regulations on that, but that's not my program.
So without those co-ops, there isn't much opportunity to expand the amount of competition then. I see that my time's expired. I hope that the record will stay open so that we can submit questions.
Absolutely, yeah. Well, it'll be open for at least 48 hours.
So I got another 100 questions that my state needs answered. And
Okay.
we need them answered quicker than 6 months like we got with the response from the Secretary.
On that point, Mr. Cohen, it really would be wise to answer these questions very promptly.
And I would just say, we will do our best to answer the questions that we get as quickly as we can. I will say with respect to Wyoming, I mean, I have personally met and spoken with the Insurance Commissioner of Wyoming a number of times with respect to the exchange and the options available to Wyoming. And I know that my staff is on the phone with every state talking with them about their development and the choices that they're making on a regular basis.
Thank you.